Good morning to all. My name is Dr. Gulwish Sadique, Assistant Professor by Post, Faculty of Paramedical Sciences, Department of Physiotherapy, Rama University, Kanpur. I am here to give a lecture on the topic itself that is called rheumatoid arthritis. So basically rheumatoid arthritis is also known as RA. So in day-to-day terms we use the word RA for referring rheumatoid arthritis. So now let's focus on what is actually rheumatoid arthritis. So rheumatoid arthritis is basically an autoimmune disease, autoimmune disorder of the body where it is characterized by mainly symmetrical involvement of multiple joints who are suffering from synovial inflammation or thickening. Okay, so this is all about rheumatoid arthritis. So this was all about what is rheumatoid arthritis. Let's focus on now what is the course of rheumatoid arthritis. So course can be variable, it can variate, course can variate, and it depends upon the extra articular structures which are involved, which are basically, for example, eyes, lungs, as well as lymphoid tissues. Now, it can also involve the systems of the body that is actually organ involvement. Okay. Now, etiology. Basically, RA etiology is unknown. Precisely, there is inflammation which can be seen in the joints. So inflammation is basically the synovial which is got to be thickened, and which we can see through our eyes that some sort of swelling is persisting inside the joints. So etiology is basically that is unknown. We do not know what is the actual cause of rheumatoid arthritis, but inflammation can be seen, which is almost due to synovial thickening, thickening of sheath. So that demonstrate the etiology of RA, which is unknown. Okay. So moreover, as we all know, there is certain amount of inflammation which is persisting inside that joint. So it is always thought ki whether it is due to some sort of parasitic infection or severely the patient is affected by rheumatoid arthritis. So one should have to keep a check whether the inflammation is basically due to certain sort of rheumatoid involvement, characteristic of rheumatoid involvement, or it is due to some sort of parasitic infection. So one should always focus on such things while we are assessing a patient of rheumatoid arthritis. Now this we have now gone through the etiology. Now we come on to sign and symptoms as well as the criteria involved. So basically sign and symptoms, those are also being said as criteria involved. So basically according to the researchers, the criteria were first published in the year 1958 and then it was revised in 1988. So those occurring criteria that we have in hand, those are: number one, there is persisting morning stiffness. Persisting morning stiffness. Morning stiffness can be seen in multiple joints which are involved that last up to from 1 hour to 6 weeks. So that comes under morning stiffness. This is one of the criteria of rheumatoid arthritis. Secondly, we have symmetrical arthritis. Symmetrical arthritis where the joint shows effusion, pain as well as stiffness inside the joint, that also lasts up from 1 hour to 6 weeks. Then third criteria that we face, that is arthritis in hands. So arthritis in hands, basically all the multiple joints that we have in hand, for example MCP, PIP, DIP, all those joints involvement that can be seen in terms of arthritis. So change in the structure of the joints can be seen in arthritis, and it also lasts up to 6 weeks. Then we have rheumatoid factor. Rheumatoid factor, we all know the patient should have exact knowledge about कि if there is or the person is suffering from rheumatoid arthritis or not. So one should always, if a person is coming to a physician, one should always keep a check whether one should always refer him to the blood bank for an test of rheumatoid arthritis to demonstrate whether the patient is suffering from rheumatoid factor or not. Okay. Then we have rheumatoid nodule. Rheumatoid nodule. So basically, rheumatoid nodule is basically these rheumatoid nodule is seen on the extensors of the forearm. So one should always assess while patient is suffering from rheumatoid arthritis. In severe cases, these nodules are to be seen, but one should always keep in check whether these are occurring from rheumatoid arthritis or there could be a chances of parasitic infection. So, okay, so this is one of the 5th criteria of rheumatoid arthritis. Now 6th one is radiographs. Radiographs. So radiographs will show synovial thickening, haziness, as well as erosion, and osteoporotic activity will get increased on taking a view from an X-ray. Okay, so these all are the criteria, factors which comes under the criteria or signs and symptoms of rheumatoid arthritis. Next, we are going to see what is pathology or involvement of pathology in this rheumatoid arthritis. So basically, pathology of rheumatoid arthritis is in initial event, we almost see there is swelling, pain, inflammation in the joint. So the synovial sheath becomes thick, and when it becomes thick, the movement between the two layers of the synovial sheath becomes very difficult in initiation. So moreover, the synovial fluid that takes part in this gliding and sliding movement of the rheumatoid sheath does not able to take part. So this is basically the cause or underlying phenomena of pathology. So one factor is कि there is thickening of synovial sheath, as well as there is drying up of synovial fluid that actually denotes the movement of gliding and sliding of sheath, that is synovial sheath. Rest, we all know body's autoimmune system plays a vital role, especially T cells plays a vital role in depicting whether the body is actually suffering from arthritis or not. So because it is an autoimmune disorder, so there can be a chances that there is a hamper or lack of activity of T cells. So due to which arthritis is the predisposing factors that could be seen once a patient is diagnosed with rheumatoid arthritis. Now we have fulfilled this pathology involved criteria. Now next we are going to look upon areas affected. So there are various areas which are affected through this rheumatoid arthritis. Basically one is you can see wrist, hands, ankle, elbow, metatarsal, metacarpal joints of hands and foot both, involvement of cervical as well as spine. So all those are the special areas that could be taken more extra care while evaluating rheumatoid arthritis. So these are the areas affected. Apart from these areas, there are extra articular structures, basically like we have already discussed it earlier, eyes. So eyes is basically a part of the body, and rheumatoid can affect the eyes. For example, lacrimal glands of eyes that could be dried up, sweat glands can dry up. Also, like we have talked about the lungs, there could be a predisposing factors that could be seen in lungs while patient is suffering from rheumatoid arthritis. So all these are the specialized areas which could be affected. So, and the special or the things which used to be, taken extra care for this is rheumatoid nodules that could be, present on the extensors of the forearm. So, one should keep an extra care or take a look ki whether rheumatoid arthritis is in severe cases showing the predisposition of rheumatoid nodules or not. Okay. So, this will all come under the areas affected. Now we are going to talk about the deformities. So, deformities are the actual part where the physiotherapy comes into play, and it takes a major role in rehabilitating a patient in case of deformities. So, let's talk about, there are various type of deformities. One patient could get affected while if he or she is diagnosed with rheumatoid arthritis. So, number one, if you will see, there is the drying up of your eyes as well as of your salivary glands. Okay, so there is drying of eyes and salivary gland. There is also subluxation which could be seen in C1 and C2 vertebra of cervical. Also there could be a chance of seeing systemic disturbance. So number of organs and joints can be involved which could lead to systemic disturbance if a person is diagnosed with rheumatoid arthritis. Then major criteria that you need to look is, that is pain. So pain could be one of the criteria which could be seen in rheumatoid arthritis. Pain, swelling, effusion present in multiple joint, that is in the form of fusiform as well as spindle form. Okay, the effusion which needs to be seen is in the form of fusiform or spindle form appearance. Next, what all we can see is, we can also look for in deformities. Those are basically present, for example, in PIP and DIP. For example, like I gave you an example just like swan neck deformity. So swan neck deformity is basically an hyperextension of PIP joint and flexion of DIP joint. Vice versa, if you need to tell about, if I need to tell you about regarding Butner deformity, it's just an opposite of swan neck deformity, in that PIP joint basically goes into and flexion, and DIP joint goes into hyperextension. Okay, so that will come under Butner deformity. Then Z thumb plasty. Z thumb plasty is mainly in this flexus pollicis longus as well as brevis. Both the tendons are affected while if we are going to use that thumb, there could be a restriction in the activity of initiating a movement or during gripping activity. Okay. So next, what all deformities you can go for and look for? One is mallet finger. Mallet finger, there is always a deformity where the tendon, flexor tendon gets hampered or its activity gets restricted. Okay. Next, what all you can see is, you can always go and check whether there is a synovial thickening or not. So basically, synovial thickening, which is the predisposing factor that will be seen during rheumatoid arthritis itself. Rheumatoid nodules, again rheumatoid nodules will be formed on the extensors compartment of the elbow joint, whereas there is always a generalized weakness persist in the body. There is disturbance in the systemic involvement. Also there is weakness, fatigue, there is a loss of strength and power in the muscle. Insidious action could be take place, or it could be, occurrence of rheumatoid can be rapid, very rapid. So all these are the factors on which the rheumatoid arthritis is based on, and one should always look and ask the patient if he or she is facing such certain criteria or signs and symptoms. Okay. Now we'll focus on the treatment. Okay. So treatment itself says, treatment can be an multidisciplinary approach where both function as well as psychological factors could take place. You can always combine both of them for rehabilitating a patient. So drugs involved in this rheumatoid arthritis is basically, you can give painkillers. Those are simple one, that is NSAIDs, and you can also give and modified anti-rheumatoid drugs. Those are antibiotic in nature. So you can both give in order to treat this rheumatoid arthritis. So here we have all completed what is basically rheumatoid arthritis is, what is its course, its etiology, signs and symptoms which you will see on assessing a patient, as well as the pathology that is involved in rheumatoid arthritis. Always you can also go and see the areas affected while evaluating a patient and the deformities that are going to persist in order when the rheumatoid arthritis if left untreated or undiagnosed. So deformities will persist where there is a chances of chronic involvement of these criterias. Then last, treatment I have already told. Treatment should be simple, like you can give NSAIDs. Apart from NSAIDs, you can give anti-rheumatoid drugs. Apart from them, you can always get a tie-up with all the medical team members that you have, whether it is vocational team member, social team member, or therapist, physiotherapist, or an occupational therapist. So all those members combine to form a team and will help a patient if a patient is suffering from rheumatoid arthritis. So here I conclude that we have ended our lecture on rheumatoid arthritis, and thank you for the same.